Muy buenas noches. Son las 19 horas en punto del sábado 16 de mayo de 2020. Estamos en el Palacio Nacional de México, en la Ciudad de México. Vamos a iniciar la conferencia.
Good afternoon. We're ready to start our daily press conference about the COVID-19 situation, the pandemics caused by SARS-CoV-2. Today, I'm here alone, as you can see, and I'm going to focus on many topics. First, I'm going to give you the technical report. Afterwards, I'm going to talk about the municipalities of hope, and I'm also going to explain the concept of municipalities of hope. And I will also talk about herd immunity, which is an appealing topic, as if you may. Going to stand up. Hold on. I'm going to bring my cell phone with me. Today, it's day 55 of the social distancing campaign, and we're still 15 days away of the end. And I would like to remind the Mexican citizens that the social distancing campaign is not over. The next 15 days are extremely valuable as to preserve the mitigation and reduction of COVID-19 transmission. So if we stay at home, if we stay away from public spaces, if large, small, middle-sized, or micro companies not involved in essential activities remain closed because they must not yet be open anywhere throughout the country. This is our national campaign, which implies this is a general mandate of the government for public and private entities whose activities have not been classified as essential. They cannot open, they must not open. So if in your town you identify that there are small, middle-sized companies or large companies that are open and they do not perform essential activities, you must remember that those actions are not contributing to epidemiological control, and these actions will have consequences in around 10 days. Transmissions may increase if today, Saturday, May 16, they have economic activities, or if you go out to the street, if you interact, if you gather up with other people, if you meet other people, the consequence is that within 7 or 10 days, we will have more transmissions. And I would like to underscore Mexico City because we get the impression that there was some type of loosening of the social distancing measures. We do see more traffic, pedestrian traffic and vehicle traffic as well. So the national social distancing campaign is not over, and it is of the uttermost importance in large cities and throughout the whole Mexican Valley located in the state of Mexico, including Mexico City and surrounding cities. But Monterrey, Nuevo León, also reports opening of bars, restaurants, as well as Guadalajara, and they are the two cities where the epidemics can disseminate. So if they are still having economic activities within 7 to 10 days, we may have unleashed the virus. This is the international situation. There are 4,425,485 cases worldwide with COVID-19, 26%. In the last 14 to 15 days, they account for 1,158,525.
Ha estado alrededor de 7 en promedio, ha llegado hasta 7.4, por momentos
7%, 7.6%, or up to 7.8% of global fatality index, the global fatality rate, whereas in the American continent, the figures continue to go up. In Europe, there's been a major reduction. The Eastern Mediterranean, we have to pay close attention because they're starting to grow in terms of predominance. This is Mexico, 47,144 cumulative cases ever since February 28, 2020. 10,681 are recent cases. So it is noticeable that in the past 7 to 8 days, this number remains consolidated with a clear reason, as we all know. This is the highest point of the epidemic curve within the Mexican value. In many other cities, we're starting to see a rise in the number of cases, and only in 4 cities we've been able to observe a slight reduction. The total number of new cases is devoted to Mexico City, the urban area surrounding Mexico City, and the major urban entities. Unfortunately, 5,045 people have lost their lives due to COVID-19 complications, and we've studied 169,097 people. 92,554 negative cases. They had other respiratory diseases and not COVID-19. This is the cumulative cases map. We haven't seen major changes, and that's the expectation. We believe that the cumulative cases will still prevail, and with the symptoms appearing within the last 14 days. These are the cumulative cases, 13,000 plus 7,800. So we're talking about 21,000 cases. Reasons are obvious, and there shouldn't be confusion, because the larger the number of population, the larger the number of cases. Around 23.8% of the Mexican population lives in the metropolitan area surrounding Mexico City, so that's where we have most cases, followed by Baja California, Querétaro, Puebla, Veracruz, and many others. If we take a look at new cases, the cases of the last 14 days, 10,681. That's where we see more changes in the map, because it is a reflex of intensity of transmission, which is directly followed by the onset of cases. Baja California, southern Baja California, is now green, and it used to be in a dark red tone. This is the distribution. Mexico City, the state of Mexico, the Valley of Mexico account for the highest activity of the disease, followed by Tabasco and Veracruz, that was below, is now the 4th state with more case contributions within the last 14 days, followed by Baja California, Puebla, Yucatan, among others. In terms of incidence, and this is extremely important so we can properly compare different population sizes, because the states are different and they have different amount of population. So we have to contemplate the number of new cases broken down into the area of interest, the 32 federal entities. So altogether, there are 8.35 people, as per 100,000, have gotten COVID within the past 7 days. This is the bar chart that explains that in Mexico City, every 30 per 100,000 people have got the disease, which gives us the incidence rate. This is why it is so important to stay at home. You have to stay home, especially within the next 2 weeks, within the next 15 days, because in the Mexican Valley, in the Valley of Mexico City, is where the most cases are located and where we can find potential transmission. So if you go out to the street in the Valley of Mexico and elsewhere throughout the country, but most particularly in the Valley of Mexico, if you go out of your home, you will contribute to transmissions. Perhaps you will get the disease, somebody you love, or somebody you don't even know that may acquire the severe form of COVID, and we don't want anybody to contract that disease because it advances, it progresses rapidly to pneumonia, to respiratory failure, and it can also lead to death. So we should stay at home for the next 15 days. Tabasco, Yucatan, Morelos, Tlaxcala, among other states, follow as per incidence rate. These are the deaths. COVID causes deaths, and 5,045 people have already died in Mexico, and we are currently identifying additional 535 deaths to find out if these people actually died of COVID-19. As we've mentioned repeatedly, there are other cases that we are not able to collect samples to run the appropriate tests. And you do need to know that Mexico has, just as any other country in the world, the right measures and mechanisms to run the necessary tests. So we need to consider the likelihood of a patient having COVID according to the guidelines from the Mexican government set out on April 13 based on the WHO and the International Classification of Diseases. So the record of deceased people who may have died out of pneumonia must also be considered as potentially COVID fatalities. And if these people died out of another respiratory disease, we should also assume they died from COVID-19. This is the specification. April 13, 2020. That's the procedure. And right now, civil registries and many other public offices are closed because we're in the acute phase. But as soon as we get out of the situation, we will update the records just as other countries do, Canada, the United States, that use statistic and epidemiological surveillance systems similar to Mexico's. So when we get acquainted with the estimate magnitude of both the fatality and lethality rates of COVID in Mexico, we will notify, we will report it with the analytical information so you can better understand the disease. This is the distribution as per federal entity. We have Mexico City, followed by Baja California, the state of Mexico. These are the municipalities surrounding Mexico City, then Tabasco, Sinaloa, Veracruz. In this slide, we see the cases as per onset of symptoms. So this is a slightly different epidemic curve, and you can see that there are 29,000 cases being studied. They're not the same people. Some of them end the lab tests, period, and they are considered negative. The technical process of laboratory tests lasts 6 hours, and whenever you incorporate the data, the traffic light changes, and it changes to the color red. But suspected cases are increasing continuously throughout the country, throughout the large, middle-sized, small municipalities. And we identify this data as an extremely valuable data of epidemiological surveillance. So the burden of the disease, the dynamic of transmission, and territorial dissemination of the disease must and can be recognized as people have clinical signs and symptoms identified as suspected COVID-19 cases. Finally, this is the cumulative epidemic curve, 144,000 cases, 2,100 cases were added up in the last 24 hours, which accounts for a 4.7% increase. Now that it's Saturday and we have a little bit more time, the curve will never go down. It will never go down. The only thing that will happen at a given moment, if the rate at which new cases appear, it may have a different type of inclination, a different slope. Eventually, it may reach a point where it will flatten, but it will never go down. And I'm saying this, and I would like to underscore, because I have seen journalists and broadcasters out there that interpret things in an alternative way, that's as to call it, when they talk about flattening the epidemiological curve. You must not have the expectation that the curve will go down. It will never go down, because these are COVID cumulative cases. When the time comes and new cases, or the number of new cases goes down, it will flatten and it will become completely horizontal when nobody gets the disease. There are still many weeks or potentially months to go, as other locations other than Mexico City, because they're just in the onset of the epidemics or still in the intermediate stage. This is another curve. This is the epidemic curve of new cases, and perhaps this curve may go down. So the height of the columns, which account for the number of new daily cases, as it has happened, certain days it will move slower. It will reach a lower height until it reaches zero, when we no longer have new cases. Just as the other curve will flatten, we will no longer have columns here, but we're still a long way to go. And I would like to remind you what it means to flatten the curve. To flatten the curve means that comparatively, if we compare the situation to the scenario of not having done any interventions, we have a curve whose size, the sum of all these bars, which is the curve, is 75% smaller than whatever would have happened without any type of interventions. So technically, I'm using technical jargon. This is the contrafactual scenario. Contrafactual means what would have happened without interventions. Without interventions, the curve would be considerably higher. If we saw this in terms of cumulative cases, instead of this slope, we would have, a vertical slope, such as what happened, and unfortunately, in several other countries whose epidemics, whose pandemics have been awful. Although, fortunately, many European countries are already in the control phase, but this is an expression of how we flattened the cumulative cases curve. So instead of this height down here, we would have been this high. So this is how you explain how the curve is flattened. Out of 734 hospitals designated for the COVID treatment, 707 within the last 24 hours have identified hospital occupation, which account for 14,000 beds available and over 8,000 beds still available. In this bar chart of bed availability, we see the national numbers of hospital occupation, which accounts for 39% if we add up all the hospitals and all the beds. As per federal entity, starting with the location with the largest hospital occupation, 73% in Mexico City, followed by 58% in the state of Mexico, the state of Guerrero, 54%, Baja California, 52%, Sinaloa, 45%, and so on and so forth. This is the occupation of beds devoted to critically ill patients in intensive care units and the areas refurbished for critical care. We started with over 1,000 beds in our healthcare system, and thanks to reconversion and expansion efforts, we've reached over 8,500 beds for critically ill patients. Sinaloa as the largest occupation, followed by Baja California, followed by the state of Mexico, and we now have Mexico City with 56%. In the intensive care unit, it's no longer Mexico City that has the largest hospital occupation, which perhaps is an early sign of starting to stabilize the epidemic curve. Let's take a look at the municipalities of hope. This is a new topic. This is a topic of interest. Please take the pictures. Of course, you know that this information is a public domain. We upload it to our coronavirus.gov.mx website. And you can also take a look at the data provided by the National Council of Science and Technology through the National Research Centers, particularly the Geo Center. What does this mean? Before we start talking about which municipalities we're talking about or where they are, why were these municipalities designated? Throughout several weeks, we identified, as we said before, we identified that the COVID-19 epidemic distribution in Mexico, just as in other countries of the world, namely large countries, does not spread evenly or in a homogeneous fashion. So not all cities or municipalities present the same intensity of transmission. That's why we don't have the same number of cases throughout the municipalities, because the size of the population differs. So indicators such as incidence, change rate, new cases, hospital occupation, both general beds and intensive care beds, and fatalities, mortalities vary throughout the different federal entities. Around 4 weeks ago, the situation allowed us to identify a major opportunity of handling the epidemic efficiently, as to prioritize the areas with more activity so we could start controlling the situation, but not through mitigation efforts, but through containment of suspected cases, as we did in phase 1 in the regions and municipalities with low or null transmission, low or zero transmission. So it's like they go back to stage 1, to phase 1. So among these areas, we find municipalities mainly in rural areas, in areas that are far away from large cities or small cities with scattered groups of population. In these areas, transmission is low or null. So as we reach an end to the national social distancing campaign, we've found ourselves in the with the opportunity of going back to economic activity in those municipalities. And things will never go back to where they were before. We're entering a new normal, and the new normal implies following the general control and prevention recommendations, in addition to contemplating specific public health activities aimed at prevention of risk populations, so we can actively monitor the situation, and if there were a certain epidemic activity, we could work on early transfer of patients in those municipalities if they should require hospitalization. So this is all part of a packet of interventions. We have several federal entities. The state of Oaxaca is the leader of the municipalities of hope. There are three categories. Number one, the states without cases, and no, not states, I correct myself, municipalities without any reported cases, and these municipalities are not neighboring a municipality with reported cases. In the next column represents the municipalities with reported cases, and the third column represents those neighboring municipalities. In applied epidemiology, we have to consider two periods of incubation. There are two periods of the clinical course of a disease. It's like an interval that will allow you to acknowledge that there is no longer disease transmission. It is arbitrary, but it is pretty much conventional to use a reference rate like this. As a matter of fact, in this case, we're taking 4 periods of incubation into account, because the incubation period of COVID is 7 days, and we want to be as extreme as possible with 28 days of 4 periods of incubation. And as we see the response to changing to the mitigation modality in these municipalities, and if we identify municipalities that have not reported cases within 21 days, or their neighboring municipalities, they will have 15 days. And of course, we're monitoring them on a daily basis. We will start with 28 days. If no cases are reported within 28 days, we don't have a preset date, but at a given moment, if we verify there's a positive response, we will start to consider others. 334 municipalities are ranked in this category. And there's something else. We must also ensure that there is little to none intermunicipality mobility, specifically among those neighboring municipalities, or municipalities where cases have been reported. This is not a thorough list. Just take a look at the numbers, but today at the coronavirus.gov.mx website, you will find the full list of the total number of existing municipalities, all broken down into these 3 categories. Next, please.
We're going to see a graph of the different maps. These are zoomed in into different regions of the country. And again, let me emphasize that this is present in the different countries around the nation. And you see different colors, red, green, and yellow, which is the contagion rate. And these are municipalities that are around contagious areas, but they do not have contagions themselves. The yellow zone is also contagion-free, but they neighbor
En
other
Sonora,
municipalities
en
who are
Chihuahua,
not contagion
unos
free.
pocos en Coahuila,
This is Sonora,
en Jalisco,
Chihuahua, some of
en los
them
altos
in
de Jalisco,
Coahuila,
la siguiente,
Jalisco, in the upper part of
aquí se puede
Jalisco.
ver,
Next slide, please.
en Tamaulipas,
You can see
principalmente en la
this
zona de
better
la
on the
Huasteca,
screen right now.
la
Tamaulipas,
siguiente,
specifically in
en
its
Aguascalientes
Huasteca
también,
zone.
aquí tenemos
Next,
Tamaulipas, aquí está la
Aguascalientes as
Huasteca,
well.
ahí
Here you
están
can
zonas
see
fronterizas, la
Tamaulipas
siguiente,
and the neighboring areas as well.
Jalisco, es el mismo
Here you
mapa,
can
lo
see
estamos
Jalisco
recorriendo nada más para
on the
visualización,
same map.
Durango, la
We're
zona
just
central de Durango,
moving it around,
la siguiente,
and on the central part of Durango as well.
en la zona central nos vamos a ir acercando hacia
This is the
Oaxaca, donde
central
está la
region
mayoría, pero
that we're
vemos
closing
Puebla tiene
into
también,
Oaxaca.
en la Sierra Norte de
But let's
Puebla
look at
hay una
Puebla.
región con
They
estas
also have the
características.
northern
Noten
part
a
of
pierna de
Puebla who
vista
has these
lo amarillo.
characteristics.
En lo
Please
amarillo no hay contagios
do not
tampoco,
leave out the yellow
no hay
zones.
contagios,
These are
pero en este
contagion
momento
free.
no son elegibles como
But
municipios de la esperanza
at this
por esta
particular
razón.
moment
La
in
siguiente,
time, they do not qualify as a hope municipality
Oaxaca es
for this
donde
particular
claramente,
reason.
tanto en la Sierra Norte
Oaxaca, you
de
can
Oaxaca
clearly
como en la Sierra
appreciate
Juárez
both
y
in the
también
north
hacia la
and
zona de
in
la
the
costa
Juarez
hay
zone
municipios con estas
and towards the
características.
coast.
Noten
You
ustedes
can see
que
that there are
prácticamente la
municipalities that
mayoría
fit
del
this
territorio del estado de
characteristic.
Oaxaca está sin
Most of the
contagios.
territory of Oaxaca is
La
contagion
siguiente,
free right now.
ahí está, Oaxaca, y vemos
And you can see
también
this better here,
Chiapas en
Oaxaca,
los altos
and we can take a
y
look at
también hacia la
Chiapas
zona norte,
and the
donde
upper
está
part of it
el
towards
municipio
the
de
north,
los municipios sin contagios. La siguiente.
where you can have
Por favor,
contagion free
En
municipalities.
Yucatán hay una zona también
The next
extensa
slide, I think I've covered all the map.
y colinda
In
con
Yucatan
Quintana
as
Roo.
well,
Toda esta zona no tiene
there
contagios
is a big
y el único
area
que
that
queda
is
elegible
neighboring
es
Quintana
esta
Roo. It's
parte,
contagion
pero
free. The
vamos a ver,
last part that we
recordemos
need
y
to
que
look
quede
at
muy
is
claro,
this particular
esto cambia
area. And
dinámicamente. En un momento
let me
dado, que los
remind you
municipios
of
verdes
that this is
tuvieran a
critical
un
for us.
vecino que
In a
empieza a
given
tener
moment where the
contagios,
green
pues
areas
desde luego
have
el
a
vecino se
neighboring
pasa a rojo y
area
el
that
verde se
has
pasa a amarillo.
contagious, they will turn to red
Y
and
si
the
ese
red one
verde
will turn to
empieza a tener
yellow,
contagios,
okay?
se pasa a
And
rojo
if that
y
particular green area has
ya no se
contagions,
puede
then it will
considerar
turn red,
elegible.
and then we can
En ese
no longer
momento
take it into
se
account
procederá de
for
acuerdo a
our hope
disposiciones locales,
rate.
pero con
At that
recomendaciones
particular moment,
federales.
it will
La
be
recomendación será
reevaluated with
cerrar la
federal
movilidad
recommendations
en el
at
espacio
government level
público.
to close
Cerrar la movilidad
mobility
en el
at
espacio
public
público.
spaces.
Esperamos que
Again,
logremos
close mobility.
mantenerlos sin contagios
Hopefully,
para
we will
que
be able to keep them
no tengan
contagion
el
free
impacto negativo que
so that
sí tienen, como lo
they
sabemos,
don't
las
resent the
intervenciones de
negative
reducción de la
impact that they
movilidad.
had
La siguiente,
based on these mobility
inmunidad de
reductions
rebaño.
that have happened recently. And
Todos
now we
vemos que
have
son
herd
7.
immunity. I
Araceli
still have
preguntaba
time,
ayer,
it's only
Araceli de Canal
7:30.
11, y se lo agradezco,
Araceli
sobre el
from
concepto de inmunidad de rebaño.
Channel
Es un
11 was
concepto
asking me yesterday,
importantísimo en la
what
epidemiología de las
was
enfermedades infecciosas
herd immunity?
que
And
permite
I find
tomar
this a
ciertas
very
decisiones
important
útiles a la
topic
práctica de la
as
prevención
in
y
terms of
control de las
medical terms that
epidemias
helps us
de
take
enfermedades
decisions for
infecciosas.
immunity development
¿Por qué se
and to
llama inmunidad de
prevent
rebaño? Empiezo
the
por el nombre,
development
que ha
or
sido
infectious
integrante
disease.
para una parte de
Herd
la
immunity has
ciudadanía.
brought the attention of different
Un
people in
rebaño es un
the
conjunto
citizenship.
de individuos de la especie.
A herd can
Típicamente
be
pensamos,
considered
cuando
a
pensamos en
group
un
of
rebaño,
individuals
pensamos
of
en ciertas
this
especies animales
particular
de
gender.
interés
And sometimes we think of different
ganadero,
species,
pero ciertamente cualquier
probably in terms
colectividad
of animals,
es un rebaño.
but definitely any
Por poner
type
una
of
especie.
collectivity could
Si
be
son peces
considered
se
a
llaman
herd of a
cardúmenos, si
particular
son
species. You know,
ganado
we
bovino se
have
llama hato,
different names
si
for
son
fish
cerdos se llama piara.
or for
Cada
cows
especie
or
tiene
for
su
pigs.
propio nombre,
Every particular
pero los
species
fenómenos
has a particular name for
relevantes
it.
para la
But
transmisión de
the
enfermedades
different
infecciosas son
phenomena that are important
semejantes
for
en
transmission of
cualquier
these particular
especie
diseases
de
are
animales,
similar in any
incluidos
given
los seres
species
humanos, que
of
también somos
animals,
del reino animal.
humans included, who
Nadie debe
also belong
ofenderse
to the
porque se
animal kingdom.
piense en esto. ¿Qué es importante aquí? Las enfermedades infecciosas
What's important to
se
consider when talking
caracterizan
about
por
herd
mecanismos
immunity
de transmisión.
is that
Hay
infectious
enfermedades que
disease
se
are
transmiten
characterized by
por
the way
vía
they are
respiratoria,
transmitted.
como es el
Sometimes
caso
they
de
are
COVID,
transmitted
de
through the
influenza
airway,
y de una
like
enorme cantidad
COVID-19,
de virus
influenza,
y
and
bacterias
other type of
respiratorias.
viruses,
Hay
bacteria
enfermedades que se
that
transmiten
get
por
into your airway.
otras
Some other
vías,
diseases are
agua,
transmitted through different
alimentos,
ways, like water,
vectores, como es
food,
las
or
enfermedades
different
transmitidas por
axes,
mosquitos aedes,
like
dengue,
those
chikungunya,
diseases
zika. Hay
which are
enfermedades que se
transmitted
transmiten por
through a
sangre.
different
Hay
animal,
enfermedades
like
que se transmiten
mosquitoes,
por
like
contacto
Ebola,
directo.
and
Hay
others.
enfermedades que se
Some of
transmiten
those diseases are transmitted through direct contact or through contamination of water and other elements that are within the nature. There are several ways of transmission mechanisms. The concept of herd immunity potentially applies to any disease of any given mechanism of transmission that is clearly identified when we are talking about human-to-human transmission ways. Of course, there are some sexually transmitted diseases, and those are important as well for our public health. But when we have a group, let us think of what I'm showing on the screen right now in a diagram, these group of people that might be presented with the disease, they can only interact with a limited number of people, and that depends on your social conduct on our daily life. It also has to do with where we live and the space we have available. But we do not interact with all the people at the same time. It might be that some of the people that we interact with, we might all be susceptible for this disease. Like this pandemic, specifically, where no one in the world before the couple of days of January had developed immunity towards this disease because this was new. So regardless of who they are in touch with, a transmission will happen. It doesn't necessarily mean that every single human interaction are guaranteed to end up in transmission. There are several characteristics that will establish that not all of human contact between someone who has the disease and someone who is susceptible to it may result in a final transmission. Lastly, for it to exist, a transmission chain, let's say me, I have the disease. Let me set you an example. Hopefully this is not something that might happen to me or any one of you. This is just a figurative example. I'm not abstracting publicly that I am wishing for you to get this disease. So let us say that I do have COVID-19. I have interaction with any one of you, and now you get it. As days go by, let us think that it happened. We survive, just like 8 out of 10 people survive. Let's just say that we develop immunity. We have immunity toward COVID-19. If someone else who has the disease gets in touch with us and they interact with us, let me use you as an example. Are you okay with it, ma'am? Yes. All right. So let's set us both. Someone interacts with us and they leave. We can no longer get the disease. So both of us are a barrier towards the person who will show up with the disease and is ready to transmit the disease. If it's just us, then he can still transmit the virus to more people. But if it's 4 of us, the probabilities go down. If we are 6, 8, or 12 of this particular community, where we are about 40 people, if we have a higher rate of immune people are together, the probabilities for transmission are decreased. We do not need to reach 100% of immunity because those who are immune are acting as a barrier to those transmission. This is the general idea that it's presented here as a hypothetical example. 4 out of 5 people that might be in touch with someone who might transmit the disease, they will no longer transmit it themselves. And hence, the disease will stop spreading. The image that I'm depicting here, it's a herd that it's imposing a barrier to transmission. Finally, there are some diseases that have low levels of transmission, and there are some others that have a high level of transmission. Some of the most transmitted diseases in humans are measles. And some of the questions that I've had here are regarding that particular disease. The larger contagion group it is, The larger the percentage of persons that must be immune are needed for them to achieve the protection balance point that will be considered as a herd immunity point. Less transmittable diseases can achieve herd immunity balance point without having to have such a high rate. But mostly, we do not need to have 100% of immunity. I will close my speech by stating two different things about COVID and a general aspect. The general aspect one is for the different vaccination campaigns, this is very important. These will establish what is the ratio of people that need to have immunity to avoid the sourcing of this disease. And with my measles examples, we do need to guarantee effective vaccination campaigns around the country so that we can stop measles transmission. If those particular campaigns begin to fail, and we do find the right number of people who are not immune, we might have a measles outbreak, sorry. I have said that measles is one of the most highly transmittable diseases for human beings, and COVID has a high transmissible rate. It's higher to influenza but lower than measles. And some of my forecasts say that we do need less than 70% of immunity in any given population, whether that's Mexico, Germany, Switzerland, the US, so that we achieve herd immunity and that it would help exhaust the outbreak. And this is very important. And I will lastly say that our forecast of immunity population is one of the key elements so that we can take healthcare decisions for when we're going to reopen and when are we going to establish mitigation and control divisions. Let me give you an example of something that I was part of myself. When we have the influenza pandemics in 2009, this is a study that we presented after a survey, and we carried this out back then so that we could take the decision of whether or not we could lift off our state of emergency. And through this survey that we performed around February and March 2010, and the pandemic outbreak began in April 2009. And by February and March, we did a survey using specific samples of blood from different blood banks. We have a percentage expected to develop immunity towards influenza. And this was presented as evidence to the Health Council, and this was decided through different elements that it was safe for us to leave the state of emergency. So for COVID-19, we are looking at doing the same, and let me just take a seat so that I can answer your question. We are looking to do this particular survey as well, so that we can establish what is the proportion rate for those who have immunity already. Those are different surveys that we will be carrying out. Some of them have to do with the technical guidelines for health security at work, which we have been touching on recently, so that we can perform surveys in the working areas for SME and also for the National Survey for Nutrition and Health, which after 2020, it will be done annually, which is conducted by the National Healthcare System. We are making it fit so that we can look into COVID and then develop a COVID-19 survey itself. Let's open our Q&A round. So let me just give the floor to you, madam, and then you, and then you. Thank you for this explanation, sir. Do you have a forecast based on the percentage that you have given us? What is Mexico's position in terms of herd immunity that you just presented. Based on what you said, you are saying that this is a factor to reopen to our new normality. Another question I have is the survey that you are stating, you're looking to do testing or just a mere survey? All right, so when I talk about this particular type of survey, this is an interview so that we can recognize different data like demographics and others and carry out questions if you have had a fever in the past few days, amongst with other questions. And when we take the blood sample, that particular sample will be extracted of its serum, which is the liquid component of blood that has different components like protein and others. But out of the serum, we will carry out the study so that we can determine the amount of antibodies that we will have looked into that are important, which are the IgN, which are acute phase antibodies, and they begin to increase their concentration in the few days after they get the infection, and they are short-lasting antibodies, 3 to 6 months, and the IgG ones that are long-lasting terms. Let me be clear about something at this particular point. The whole world itself is facing a particular limitation, which is even after 3, almost 4 months of the first outbreak, we do not have solid scientific agreed upon decision on when the antibodies begin to increase and up to when and up to which level of concentration they are risen, how long they last, and the most important thing, if the concentration that we can look is a synonym for biological protection. At a given point in time, I'm sure that this information will be agreed upon and it will be extremely useful. And let me just give you particular news of some serological surveys that some countries have begun to perform and present their results. New York presented one about 4 weeks ago in which they showed a 23% result. France, through the science survey, the Pasteur Institute presented a study, which was quite fancy, was done through a serological survey and a mathematics forecast. It showed only 11% of herd immunity. And through the Ministry of Health in Spain, last Thursday, they did their preliminary results from the serological survey, and they only recognized 5%. We need to reach 70. And in Mexico, at least as a government effort, we have not done one, mainly because we believe that when the curve flattens, it's a better suited time to perform this survey, because right now it's not important. It will be important later. Unless we get very high results and very high rates of immunity, it's only when it will be done. No microphone for the reporter. I could not hear the question. But we are planning out of the nutrition state that by July, we will be working on it with the National Health Institute. Let me thank Dr. Rivera right now, who's the director and all its scientific team, not only for this particular effort, but most of the counseling that we have had has been coming from this particular institute. You are next, and then you are next.
Doctor Hugo López Gatell, muchas gracias. Soy Toño Visa, de Toño Visa Channel Subterráneo.
Thank you so much, Doctor. My name is Hugo Visa.
Mexicanas y mexicanos, porque también me baso en informarme de lo
I would like to thank
en las
you
redes sociales,
because I also gather information from your social media. I want to thank your responsible attitude from the health ministry so for you preventing a hospitality crisis. I find that very important, and your activity to survey how the pandemic began from China all the way to Mexico. We would like to thank you for that. Now, my question is,
el hecho de informarnos un
Why
poco más
didn't
de
the
alimentación en
health
más
ministry
conferencias. Es tan
forecast it?
importante porque contamos con muchas plantas y muchas frutas en nuestro país que realmente
Why
nos
they did
ayudan a
not
fortalecer
forecasted a
nuestro
particular
sistema inmune,
diet
además de
to
nutrirnos.
strengthen our immune
Segundo, ¿por qué
system,
no ser un
other
poquito
than the
más,
nutrition that they
también
bring to us?
traernos más
And my
conferencias
second
sobre
question is,
psicología? Digo,
why
las han
not
traído, pero
more
pensamos
conferences
que es en
on
un número
psychology?
muy, muy
We have
mínimo
had
y
some,
esto ayudaría
but we
también
believe
mucho a
that they have
aprovechar
been
la
very limited.
oportunidad para
And we
concientizar
believe that this might
a
be
la
very helpful
población, a
to raise
ayudarla a
awareness in
madurar,
population
ayudarla a
and to
entender.
help them
Estas son mis
grow
preguntas.
up
Gracias.
and
Le agradezco
understand
sus
our
preguntas
situation.
y si
Those
me
are lo
lo
my two
permite, se las
questions. Thank
tomaré
you, sir.
como sugerencias y
Thank you very much.
recomendaciones sobre las que
I
podemos
will
actuar.
take them as a
Efectivamente,
suggestion,
pues la
actually,
cantidad de lo que
through which
hayamos
we
hecho
can
hasta ahorita,
better
pues ya no
our
lo podemos
service.
recuperar, pero todavía veo
And probably,
oportunidades.
what we
Como
have
usted
done
bien
so far
señala, la
cannot be recovered,
nutrición
but
es un
what we can
aspecto
do
fundamental
is that, as you say,
de la
nutrition
salud humana.
is a key element
En su
of
momento,
human health.
ya que estemos
And
con
at its
menor
given
cantidad,
moment,
menor intensidad de la
when
transmisión, vamos a empezar a
the
enfatizar
intensity of
este
transmission
tema que
has
ya
lowered,
mencionamos sobre
we
las
will
consecuencias
emphasize this
negativas de una
topic
mala alimentación
on the negative
en México,
consequences
que
of
están
having a bad
fundamentalmente
nutrition in
determinadas
Mexico.
por una sobreoferta de
These are
productos
highly
industrializados
established
de
by
muy bajo valor nutricional, altísimo poder
excessive
calórico
offer
y que la
of
evidencia científica es muy
highly caloric
robusta,
value
muy
and very
consistente en
low
demostrar que
nutrition
son el
value
motor
foods
de la
advertised
epidemia de
elsewhere.
enfermedades crónicas
And these
en
are
México, la obesidad,
definitely
75% de las
the
personas
trigger
mexicanas
of obesity
tienen
rate
sobrepeso u
and
obesidad
other
y
health
también la
issues
diabetes, la hipertensión,
like
etcétera. Pero
overweight
gracias
and
por la
obesity, like
recomendación.
diabetes and
Y por cierto
hypertension.
que
But I will definitely take your
tanto la
recommendation.
Secretaría
By the way,
de Bienestar y
both
su titular, la
the
ingeniera María Luisa Albores,
Wellness
y la Secretaría de Medio Ambiente,
Institute
todo el equipo del
and
doctor Víctor
the
Manuel Toledo, tienen extensas
different
colecciones de
institutes that have
información
to do
sobre la riqueza y la biodiversidad
with
de
the
productos
biodiversity
alimentarios en
of
México
the
y
products,
efectivamente
of the food
gracias por la
products
observación.
that we
Y de
have.
la salud mental, pues traeremos a
I
nuestro
will take that into
equipo
account. And the
y
mental
vamos a seguir
health topic, we
enfatizando
will
eso.
bring our team
Gracias.
back
Por favor,
and we'll
usted,
keep moving
adelante.
forward. Thank you.
Sí, buenas tardes, Pablo Pérez para Verificado.
Good evening.
Teniendo en
My
cuenta
name is Pablo
este
por
momento en el que se
Verificado.
va a volver a las actividades laborales, ¿habrá algún
Taking
tipo
into
de
account
recomendaciones y
this particular moment
lineamientos
where we're going back to
de parte
our
de la
work
Secretaría de Salud
schedules,
para
are there any
especialmente
guidelines
aquellos
from the health
trabajadores o
ministry
empleados que tienen
for
algunas
those
condiciones
workers
de
or
riesgo,
employees
justamente
that
como la
may
obesidad,
have
diabetes,
risk
hipertensión?
or
¿Se dejará
vulnerability
esto a
like
criterio
obesity or
de los patrones
hypertension?
o habrá alguna
Will
sinergia con
these
la
be left
Secretaría del
out to
Trabajo?
the
Muchas gracias, Pablo.
owner's
Esta pregunta es
criteria
muy
or
útil
the work
para
ministry will
identificar
be involved?
los elementos que tienen
Thank
que
you,
ver
Pablo.
con
Your question is quite
esta
relevant. So for
transición
us
hacia la
to
nueva normalidad, uno de
identify
los
what the
ámbitos más
transition will
importantes
be
es
towards
precisamente
our new
la seguridad y
normality,
la higiene en
the
el
most
trabajo.
important
En el
factor is
trabajo hay
hygiene and
múltiples
work
protocolos
safety.
sobre seguridad en términos de
In the workplace,
lesiones,
there are
pero
different
también
safety
existe
protocols in terms of
importante
accidents,
capacidad
but there are
institucional
also
y en
there
las
is
propias
also an
empresas
important answer
sobre salud.
institutionally
El
in
Instituto
terms of
Mexicano del
health.
Seguro Social es probablemente la institución
The Mexican
pública, la
Institute for
institución
Health,
gubernamental o
it's
parcialmente
probably
gubernamental
the
con la mayor
governmental
cantidad de
or
experiencia en
public
este aspecto.
ministry
Tiene, de
that
hecho,
has the
una
most
coordinación de
experience in
salud
this
en el
particular
trabajo
topic.
que pertenece a
They
la
hold
Dirección de
a
Prestaciones
coordination office
Económicas y Sociales.
for this
Y por
that
esta razón
regulate the
nos
different
hemos
benefits that the workers may have in terms of health and
basado
others.
mucho en esa experiencia y el instituto tiene
And
un
we have
protocolo
taken their
muy
experience into
completo
account largely because
sobre
they do have a very
salud
complete protocol
específicamente
in
orientado
terms
al tema
of
de COVID.
health,
Y
which
este
is
lineamiento
particularly oriented
técnico
towards
es
COVID.
precisamente el
And
lineamiento
this particular
al que hace
guideline
referencia
is the
el
one
acuerdo del
that we
secretario de
refer
Salud
to
publicado el
in
jueves,
the agreement
en el que se
between
especifica
the
que las
health
empresas
minister, in
que en
which
este
it
momento
specifies that all the
están en los
companies
sectores de
that
construcción,
are
de producción o
within the
fabricación
construction,
de equipos
the
automotrices
construction field,
y minería,
production,
que son los tres sectores que se
mining,
incorporarán
and
en el
car
listado de
assembling,
actividades
which are the
esenciales,
ones that will be
deberán,
going back to the
para poder
essential
entrar en operaciones el
workers
1 de
level.
junio,
In order for them to
presentar
reopen on June
formalmente,
1st,
y no solo presentar,
they will need to
sino
present
poner en práctica
and
los
execute, not only to
protocolos de
present in
salud
paperwork, but to also
de acuerdo al
execute the
lineamiento que
health
establece
protocols
la autoridad
as it
sanitaria
was
y
provided
que
in the
se basa
guidelines from
precisamente en el
the health
trabajo del Seguro
ministry,
Social.
that is
Pero
also
destaco
based
también, como usted
in
ya
the
lo
work of
señala,
the
el trabajo
social
conjunto
ministry.
con la Secretaría de Economía y con la Secretaría del Trabajo. Y
We are
por cierto,
working
mi
together with the economy
reconocimiento y
ministry
respeto
and the work
a nombre del
ministry.
grupo
And by
a
the
la
way, let me
secretaria
recognize
Graciela Márquez y a la secretaria
um,
Luisa María
Secretaria
Alcalde
Graciela
Gonzalo,
Marque
que han
and Luisa
mantenido
Maria.
no solo un extraordinario interés
Two of
y
them
aportaciones
had
muy valiosas para
not only
hacer este
had
plan,
a special
sino además un
interest
liderazgo muy
and
claro
different
en la
suggestions to execute
vinculación
this plan,
con los
but they have
sectores
also had a
empresariales.
strong leadership and
Entonces, sí, la respuesta
coordinating
es
the different
efectivamente es
working sectors.
indispensable
So
que
the answer
estos
is yes,
protocolos
it's
existan, no como
mandatory
letra,
that
no
these
nada más en
protocols
un
are
libro,
in place,
sino
not
estén
only in
implantadas
paper,
en las actividades para proteger
but that
en
they are
general a las y
embedded
los
in the
trabajadores
actual
y en
activities so that we
particular
can
hay
protect all
un elemento
workers.
específico a las
Particularly,
personas que
there
tienen
is a particular
mayor riesgo de
guideline
complicaciones.
for those who
Gracias, Pablo.
have
Usted, por
a
favor,
higher level
ingeniero.
of contagion, of transmissible risk.
Nos quedan 4 minutos.
Ok. Buenas noches a todas y a
We only have
todos.
4
Lisbeth
minutes left.
Álvarez, reportera del diario Basta,
Good
del
evening,
Grupo
Lisbeth
Cantón.
Álvarez
Pues en esta misma
from
línea
Basta.
de regresar a la nueva normalidad, saber si se ya se tiene
Within
algún
this new
protocolo
train of
en cuanto
thought,
al transporte
is
público.
there a
Es
particular
decir,
protocol for
porque
public
una vez que
transportation after
regresemos todas las,
the
bueno,
new
regresen todas
normal
las
is coming?
personas a sus centros de trabajo, quizá de nada serviría que
When
tengan
people
en
go
su
back to
trabajo
their
esta
working
sana
centers,
distancia
it
y este
might not
cuidado,
be
si en el
useful
transporte
if at
público
work they can
comúnmente
keep a
pues
safe distance,
van muy
if
juntos, ¿no? Y sobre todo en las horas
when the
pico,
public transport
pues difícilmente se va a
demands
poder mantener esta,
close
pues, esta
contact
limpieza, ¿no?
at
Esta sana distancia.
the
Y
very
otra de mis
high
preguntas sería,
needed
¿cuánto
hours.
tiempo vive el
And my second
coronavirus en
question
un
is,
cuerpo muerto?
how
Y
long
nada
is
más un
COVID
pequeño
present on a
recordatorio,
dead body?
bueno, las
And a
estadísticas
friendly
de
reminder
la actualización sobre las
that
estadísticas de la violencia
the
hacia las
statistics
mujeres, que me había dicho que
needed
iban
to
a venir
be
las expertas.
updated
Muchísimas gracias.
in
Cómo no,
terms
muchas
of
gracias, Lisbeth. Sí, las
female
expertas
violence.
van a venir la próxima semana
Yes, the
y
experts
es
on
el
violence
grupo,
against women will be coming next
un
week.
grupo muy
And that
consistente, muy
particular
sólido,
group,
donde está
it's
la
quite
presidenta de
solid.
Mujeres, la doctora Nadine Gassman,
And the president
estará
for Mujeres,
Candelaria
Dr.
Ochoa,
Gassman, will be present as
titular de
well,
la
and
CONAVIM,
Candelaria Ochoa
nuestra
as well,
colega
who
directa,
leads the
Carla
CONAVIM,
Rogochevsky,
which is our
y
direct
van a comentar sobre esto.
colleague,
Respecto al
and they will be
transporte,
talking on this topic.
es un punto muy
Now,
retador,
for
pero
public
muy
transport,
importante.
that's
El
quite
transporte
challenging, but it's
es
also
un
quite important.
espacio de
Public transport
confinamiento.
is an
Es
open
casi
space
imposible pensar
in which
que
you
no
are
pueda haber
restricted as well.
reducción
It's almost
en
impossible to
una
think that
distancia
we could
menor a
reduce
la
that
sana distancia
with a
y
smaller
el tipo
distance
de
than
cambios que se
the
pueden
one
hacer. Ya
established
hay
by safe distance
lineamientos que se han
campaigns.
implementado en
And the
otras
type
partes
of
del
changes
mundo
that we have
e
considered to
incluyen
do are
básicamente
the ones
tres
that have
cosas.
been implemented
La
following
primera
different
es
guidelines in the
disminuir el
different
aforo,
parts of the world. And they include
lo cual en
3
sí
things.
mismo es un
Number
reto
one,
porque depende del número de
reduce the
unidades
number of people,
disponibles. Entonces
because
hay
that will
básicamente
increase
dos
the number
maneras
of
de reducir el
available
aforo
units that we
en el
may have,
transporte público.
but that's a
Una
way to
medida es
reduce
precisamente la que
attendance.
instrumentó,
And then
no
the
es el
second
único
one
sitio,
is the
pero es
one
el que conocemos
that
con mayor
implemented
eh,
by
importancia por el tamaño de las operaciones, el de la Ciudad de México, el gobierno de la Ciudad de México implantó
done
un
by the
mecanismo
Mexico City,
de
which is the
cerrar
most
estaciones, tanto del
relevant one
metro como de
based on its
el
impact.
Metrobús,
They chose to close
precisamente para
different
hacer un tránsito
metro
más
and
expedito,
Metrobus
una
stations
circulación
so that
express.
they could do
Y
a
esto lo que
faster
logra es
route
que haya
and an
menos
express
personas en
route.
cada una de las
These
unidades.
managed to
Entonces,
have
disminuir
less
aforo.
people
El
on
otro
each
es,
unit,
bueno,
so
también el disminuir
definitely
aforo incluye
reduce the
restricciones
concentration.
al número de
We would
espacios que
also
pueden ser
have
ocupados,
restrictions to the number
tanto
of
quienes
spaces
van de
that
pie
can
como
be
quienes van
used for
sentados.
those who are standing and
El
for
otro
those who are
es
seated.
medidas higiénicas básicas, tanto el tema del uso de
The,
alcohol
the
gel
third one is
y hace un
basic
par de
hygiene,
días me pronuncié
like
nuevamente por
gel, the
o
use
respecto a
of
los cubrebocas.
sanitizer,
Hay
and
gente que sigue
face mask.
gritando de por qué. A veces digo que sí, a veces no. A los cubrebocas es un tema difícil de
Sometimes
comprender
I say yes, and
y lo
sometimes I
trataré
say
de
no
resumir de
to
esta
face
manera.
mask.
El uso
And it's a very
indiscriminado de
hard topic, but
cubrebocas,
let
es
me
decir,
be,
todo mundo
let me
póngase a usar
summarize this.
cubrebocas,
If
no existe
everyone
una
were to
demostración
use a face
sólida,
mask, we do
consistente,
not
de que
have
pueda
proof,
servir como
at
una
least not a
medida
consistent
principal
one,
de salud
that it
pública,
may help
como una medida
as a
auxiliar
main
podría servir,
resource
pero
more than
básicamente
it
lo
is
que
an
hace que no sea
auxiliary
tan
resource.
efectivo
But
es
what it
el uso
does and what it makes
inconsistente.
it less
El que ya lo he dicho muchas
effective
veces, el que
is
se lo
that we do
pone,
not use
pero a
it
los
consistently.
20
If
minutos se
you wear it
cansa, se
and 20
acalora, le
minutes later
pica y
you are
entonces se
fed up
toca la
with it,
cara,
you're
lo
hot,
cual es un
it
mecanismo
itches,
efectivo
you
de
touch your
transmisión,
face,
o lo trae de
which is a
gargantilla o se lo
proven
quita,
transmittable disease, or
etcétera,
you put it on
o
your
lo
throat or you
comparte o
throw
lo
it
deja en la
away,
mesa
or
y
then
ya
you
lo tocó
share
alguien
it and then
más.
you put it on the
Entonces hay muchas
table and then
razones por
someone
las
else
que el uso
touches it. There
generalizado
are so
no
many
es muy
reasons as to
confiable como
why the
mecanismo
general use for
principal.
face mask is
Quien
not
quiera ponérselo
recommendable as a main resource. If you want to use it, but please, if you wear it, use it consistently like you who are present in this room. What we are taking into account is that using a face mask while on public transportation may be useful. Again, we do not have a scientific proof on it that may suggest or that might have been proven that it's an effective measure. But if we take into account that public transport demands contact, we want to reduce transmission by these barriers. So those are the three guidelines that we have taken into account. Okay, we do not have more time, but Mr. Carlos, you will start tomorrow. I want to talk about the municipalities that have hope. I want to talk about their classes. We will have an official communication on it tomorrow for the governors of different states, like in Sonora. They already know because we have been talking about it, but the official list will be given to you formally. If they choose, they could operate normally on Monday, at least the ones that are on green in our maps. But if they chose not to do it, they will be exerting their powers as a sanitary authority at a state level. And if they chose not to do it, there is no formal opposition with the federal government. But the federal government has stated that you can, and it's up to them to choose whether or not they execute such order. As that includes schools in the green municipalities. Again, only on those who have been located as a hope municipality. Thank you very much.